The next transfusion reaction I want to discuss is febrile non-hemolytic transfusion reaction. Okay, this is a febrile episode in which the temperature will rise 1 degree Celsius or more during or soon after a transfusion, and there is no other obvious cause such as a hemolytic transfusion reaction. In this situation, the patient during or soon after the transfusion will develop fever, and then we have excluded all other causes, especially hemolytic transfusion reaction. If we have checked everything is okay, then this patient probably is having febrile non-hemolytic transfusion reaction. When we check the patient, the BP is stable, the patient is not in shock, there is no jaundice, and there is no anemia, and the result from the blood bank shows no incompatibility, then probably this patient will have this febrile non-hemolytic transfusion reaction. Okay, usually this will happen associated with the red cells transfusion in patients with previous history of pregnancy and or transfusion. But it also can occur in first-time transfusion after platelet transfusion. In the platelet, usually, because we keep platelet at room temperature, so together with the platelet, there are some amount of the white blood cells in the donor's bag. So this white blood cell will produce or will secrete cytokines during the storage. So during transfusion, these preformed cytokines that will infuse together with the platelet into the patient will cause the patient to have fever. So this patient will have fever even though he or she does not have any previous history of transfusion before. This cytokine produced after transfusion, especially after the red cells transfusion. Okay, so for example, this patient has been transfused before with red cells. We must remember, even though we give the patient red cells, there are some amount of white blood cell in the donor's blood. So sometimes when the white cell also coming into the patient's circulation, the body will recognize that white cell as alien because they have antigen that the recipient does not have. So the recipient will produce antibodies against the white cell of the donor. The second red cell transfusion, they will also have some white cell inside the donor's blood. So the antibodies inside the recipient will attack the leukocytes and also produce the cytokines. Alright, and these cytokines will cause fever. I re-explain in a diagram. This is the donor white blood cell. The recipient is already having the antibody against the donor white blood cell. So the antibody will attack the white blood cells of the donor, and this will cause the production of the cytokines such as pyrogens, and these pyrogens can cause flushing, fever, tachycardia and rigors. Okay, so if the patient is having fever, first we might need to exclude hemolytic transfusion reaction, and if we have excluded all that and the patient is stable, then probably the patient is having febrile non-hemolytic transfusion reaction. Okay, the lab findings are usually negative. What I mean is negative is there is no anemia, the bilirubin is not high, the patient does not have any antibody, the antibody screening and antibody identification will still be negative, and the treatment is usually will give treatment to reduce the fever, and sometimes we can continue the transfusion with close monitoring.